I'll probably share some slides to walk you through my journey. And I think it's really timely, as you talked about, sharing the importance of healthcare and the benefit, and within this pandemic and everything that's happened, how crystallized that has become on the global scale. So for those who don't know me, my name is Dr. Nadine Hachach-Haram. I'm originally Lebanese. I'm calling out of London today. My background is surgery. I trained as a reconstructive plastic surgeon many years ago, really to focus on delivering and restoring form and function to patients. I was very passionate about making sure people could have the best care possible. And after 10 years of working within my own health system, but also around the world through global health initiatives and innovation initiatives, what really frustrated me on the front line was that we have a high amount of variation. Today, patients walking into one hospital are still having a very different experience to patients in another. There's variation in quality, variation in access, and variation in care. And probably the reason of this is because of the genesis of surgery. When we look historically at how surgery was born, it was predicated on the idea that we needed to communicate, collaborate, and be co-present in order to scale expertise and drive new innovations and techniques. If you look to the picture on the right, we haven't adapted our models to the fourth technological revolution. And so what happens is that you end up creating this idea of more people in an operating room, hoping that this will scale expertise. I'm sure you'd agree with me that this is not conducive to scale or quality. And so as a result, we have a high amount of variation. Patients, for example, even in the UK, can have 14 times more chance of having variation colorectal surgery and in others. Today, 5 billion people in the world lack access to safe surgery. And today, even in the United States, you're 3 times more likely to die from surgery in the lower performing hospitals than the higher performing hospitals. And so this idea of quite simply where you live determines if you live or how you live is something that, I feel is no longer acceptable, and we need to drive forward. And so I started to think of, as a surgeon many years ago, how do we change the paradigm? How do we change the operating room? And it became clear to me that we needed to really globalize and digitize the operating room. I still remember sitting in an OR years ago, 2014, 2015, on a footstool and looking around the operating room and thinking, why is everything so analog and so manual in this world where everything is connected? How are we still doing surgery this way? And so I created an idea around connecting and creating a data web and a connection web across all operating rooms around the world, enhancing communication, immersive engagement, so we can actually virtually reach in and share best practice, and to deliver this in a way that's democratized, so on ultra low latency, and by using existing hardware. Because the more that you can reduce obstacles and friction, the more scalable and adopted this is. And as I started to think through this, I started to think about how do we provide support? How do we expand our capacity as surgeons? There's not enough surgeons to deliver care for patients. More broadly, there's not enough surgical teams to deliver what clinical patients need. And how do we enhance preceptorship and proctorship, coaching and enhancing skill acquisition? And so that really was the birth of Proximie back in 2016. The idea that by surgeons, for surgeons, we can create a platform that can enable you simply by using a phone or a tablet or a computer to virtually scrub into any operating room, to share best practice, collaborate, and ultimately deliver the best care to patients possible. And we launched this in mid-2019. And since then, we are now in close to 300 hospitals in over 40 countries, delivering and democratizing and enhancing the delivery of care to patients all around the world. And we have published a multitude of papers and articles that supports this and shows that this is a way forward. We've done it across a broad spectrum of socioeconomic diversity, of clinical diversity and specialties. And we've been able to do this connecting hospitals and doctors all around the world, from London to the US, to Benin, to India, to Japan, to Singapore, Australia, Gaza, all these countries coming together to scale expertise. And so I'd like to share a video that perhaps also resonates with me as it comes from my home country, Lebanon, and the challenges that we've faced recently.
As an entrepreneur and surgeon based in the UK and part of the Lebanese diaspora, I was devastated by the blast on August 4th. As I saw the footage and spoke to friends and family there, it brought back memories from my childhood of a war-torn Lebanon, and that immediate action needed to secure medical assistance. This resonated with what ultimately drove me to become a plastic surgeon in the first place. the long-term consequences and reconstruction needed to help patients restore better form and function and give them a better quality of life. Giving back to Lebanon through Proximie was important because as a very multinational company, we all pull together. And Lebanon has always been a core part of our Proximie family. There was a particular case at the American University of Beirut Medical Center whereby a patient had lost his thumb during the blast,
follow my markings,
which immensely reduced his hand's function. A toe-to-hand transfer was a solution, but not a common procedure, and one which is a great learning opportunity for trainee surgeons from all over the world.
Can you see my hand now?
This is why we decided to support the case and connect clinicians through the platform using nothing more than a phone, tablet, or computer. Dr. Bakhash led the operation while interacting with trainees from all over the world, explaining the different steps of the operation and what the indications were.
Countertraction should be here.
The patient got the operation he needed, but ultimately so many other surgeons were able to immerse themselves using the augmented reality tools to interact and benefit from the learnings and familiarize themselves with the techniques to support this in similar future cases. In fact, Proximie has always been about scaling expertise to operating rooms around the world and virtually supporting surgeons to deliver great care. It has been a unique year for us as COVID accelerated the usage of our platform, and we were there to support and create impact. We made it possible for surgeons in operating rooms to dial in colleagues for the extra layer of coaching and mentoring, whilst keeping them safe and less exposed to the virus. In 2020, our business accelerated. Our team has doubled to over 50 members. Our platform is now in over 200 hospitals globally, 35 countries, and has performed over 6,000 cases just this year. And we're really filling a need that is more and more urgent than ever before. We're also proud to be part of the Endeavor Network. Every patient deserves the best care the first time, every time.
One of the key things is it's not really about technology. We can all come with a different solution that's solving a problem. I think ultimately it's about raising awareness, getting buy-in and adoption, and building trust. All these solutions that we're describing really goes back to the bit about misinformation, about raising awareness. So when even we launched Proximie, yes, half of it was about the software stack and the impact that we could make, but more so was about how do we continue to build trust with healthcare workers? How do we increase adoption and accelerate the belief in this new way of doing things? If you walk into a hospital and just say, oh, I've got this data architecture in the cloud, I mean, that's not going to resonate or land with people. So we need to make sure that the messaging and the communication around what we do is clear and that we unveil this mystery of what is in healthcare or the operating room. So we've done some things like LinkedIn Lives, we've done podcasts, we've done others, which, you know, clearly other members on the panel have worked to. And that would be the learning. Again, I think if we look across all of us, there's a common thread, and it's about trying to make impact, but trying to raise awareness and build good communications and trust in what we're doing. I mean, I think the democratization bit is absolutely key. There is a heterogeneity of health systems all around the world. And so we need to start thinking about how do we deliver solutions that everyone can have access to. If I'm delivering a solution that's only beneficial to, you know, the UK or Europe or the US, you're really obstructing access to so many other parts of the world. And so to give you an example of how you make purposeful decisions around the design, it goes back to that democratization. So, you know, when Proximie was being created, there was a lot of work around augmented reality, headsets. You know, many companies came out with pretty expensive wearables. What was clear to me at the time was that it didn't really matter if you were in Europe or in the global south, and everyone had a mobile device. So how do we find a way to ensure democratization? So we designed purposefully the software to be accessible by anyone and everyone. At that point, that's when you can really globalize these solutions and not make it obstructive based on socioeconomic status or country status or GDP, et cetera. So that I think is really critical. Speaking as a frontline clinician, someone who's worked both in the West and in the East on war zones and in wealthy, affluent healthcare systems, that is the most critical bit. That velocity and agility of scale can only happen when you design things in a way that's democratized and scalable. And the other bit to say is that the thing that used to annoy me the most is that there is this perception that actually the West is more established and therefore can adopt solutions and technologies at a much bigger pace and a faster pace than perhaps the global South. But I think we can all look back to the story of M-Pesa and many others that shows that we can have reverse innovation. We can actually demonstrate leapfrogging and scale across these geographies to teach us, perhaps in the West, how we can do things differently. So I'm a big believer in that democratization and velocity, because you want to make sure that people can adopt this and that there's evidence behind it as well. The more volume, the more engagement, the more diversity in data sets, the more that evidence and that knowledge, that data, machine learning becomes meaningful. And I think the comments about, bringing government agencies, NGOs, others working together to enable is really critical. When we think about how we've been trying to approach this, it's been very much in that hand-in-hand partnership, whether it's with ministries of health, whether it's with telco providers, the future of connectivity. To probably answer also Tash's point, we designed this to work on the lowest of bandwidth. We've done this in war zones, in camp hospitals, on naval ships, and in the field, and we've worked with militaries as well as established hospitals. So that is really critical in that design. But nonetheless, success of this is about cohesive partnership and coming together, and that really has to be about awareness, people sitting around the table, multiple stakeholders. Let's just be very clear. Healthcare is complex. There are multiple stakeholders, all revolving around ultimately the patient and the benefit to patients. And so we need to make sure that we're engaging those stakeholders and recognizing that complexity up front and putting in the effort and the work to make sure that we get everyone around the table to do that. And, again, I think my takeaway from today's panel is very much around that awareness, communication, engaging stakeholders, and making sure we democratize care for everyone.